graduate entry medicine course. So this is the new graduate entry medicine course at University of Chester that will start running this autumn. And it's great that they're here to give you an insight into what they're looking for when they recruit for the course, and also a bit more about what it's all about and how it's taught to students. So I'll hand over to you, Held.
Thank you very much. So really nice to be here. I'll introduce myself. These are glamorous pictures that we pulled off some sort of photo shoot event, and just ignore the fact we don't look like that anymore. So I'm Judy, I'm the Pro Dean and Professor of Medical Education at the New Medical School in Chester, and Lauren is a Professor of Anatomy, but she's also the programme lead as well, and we have a nice team around us that's developing the new programme. So our MBCHB programme, as you knew, as you've heard, is a graduate entry programme, and it's really important for the University of Chester. The project has been ongoing for quite a while, and it's really exciting that it's coming to fruition with our new first cohort starting in September this year. But it's really important for us and also the local NHS partners that we work with. So our aim is to deliver and produce graduates who can work across the region. So it's really useful to be able to talk to you today and hopefully get your interest. But we're really looking to produce doctors who are very compassionate, very person-centred, and can work really well with multi-professional teams. That is so important for any health professional in today's environment. And we want people as well, and our course is designed to help you work in those collaborative ways, but also to think about the healthcare delivery and the systems and actually the research that underpins it. And we will have, certainly this year coming, we'll have 50 home places, and we'll have up to 25 international students. And from 2025, hopefully we'll have a similar sort of number as well. And so we hope that our students can work around the globe, but stay in the region as well. So I don't know how you manage that, but yeah, think global, act local is what we say. So what we do to sort of help you on your journey to becoming this sort of professional is we've got lots of opportunities for interprofessional learning. In our faculty, we have nurses, midwives, dietitians, we have social workers. So we've got all these different health professionals working with us. We have physician associate students as well. And we want to help you learn how to work best interprofessionally, because that's so important. At the moment, you know, now we're looking at extended and expanded roles of health professionals. So the doctor's role is changing as those other roles change as well. We've got a really good staff team drawn from across the faculty, really used to teaching both home and international students, including doctors who come to learn on some of our programmes. And like you've got here at Liverpool John Moores, we've got a really good employability support team, including all the clinicians that we work with, so that you can actually take advantage and learn about all the opportunities that medicine has to offer. And, you know, there are 69 specialties in medicine. People don't always realise that. So there's all sorts of things you can do. And many doctors now have a portfolio career where they'll do some education, some research, some leadership, some system improvement, as well as the day job of the clinical work. What we do in our placements, and I'll talk about those later, is give you practice and experience in those rural settings or the sort of, you know, less metro settings, as well as in the urban environment, because you'll see the demographics are really different with different patient populations as you move around the region. And our famous Chester City location, combining medieval, Roman and modern. If you haven't been to Chester, and I suspect you have living here, it's a great place. It's a safe city. It's one of the safest places actually for students in the surveys. So I think all your parents would be pleased as well that you were coming to Chester. I would if my children were coming. So we're collaborating with Warwick Medical School. Every medical school that's established as a new school has to have a contingency partner that's required by the General Medical Council, and we have Warwick. They've been really helpful to us, and our curriculum, our learning outcomes and our assessments are all aligned with those with Warwick Medical School. But we have also modified and taken advantage of our expertise at Chester and what we think the needs of medical graduates will be. And actually, we've looked at the curriculum, and in some places the delivery is quite different from that of Warwick, but you will still meet the national learning outcomes. So they're our aspirations, really. And we were really lucky to have an award of 50 additional home or UK funded places. These places start in September 24. They'll obviously continue for the people who join us. And then we're not sure about exact numbers for 2025, but it will be 50 plus home students. So possibly up to about 75 home students for us. It's a small school, and I think that's really one of its benefits, that it's a small cohort. You're not in a big cohort of 300 or 400. We'll get to know you, you'll get to know us. We've got international places as well. We've got up to 25 for this year. Lauren will talk a little bit more about our entry requirements towards the end of the course, because I can imagine you're interested in that. But we do our interviews via multiple mini interviews. Okay, next one. So, General Medical Council, the GMC, we are regulated by the GMC, who regulate all the UK medical programmes, and it's an ongoing quality assurance process, whether you're Liverpool and well established, or you're brand new, or you haven't started yet. The GMC work with us on the quality assurance. It's a staged process that the visiting team come and work with us for the first cohorts work through until the final year, and then that culminates with an approval for us to award that primary medical qualification, which is the MBCHB in our case. They come and visit. We've got a visit in about 3 weeks' time, just looking at the calendar, but we're working through all the stages today with the GMC. We're approved to recruit our students, and as I said, Warwick is our contingency school should anything go a little bit untoward with us. But we're really, I think we're working really well with the GMC, and that we've got a really good, helpful team to support us in that development. And the GMC also gives us a lot of guidance for setting up our curricula, but we have to look at these outcomes for graduates. This is the 2018 version. A new version will be coming out next year, I think. It's under consultation. But what we're really looking for are these professional values and behaviours, and you'll see that this comes first in the outcomes. The professional skills, this is all about prescribing, diagnosis, it's your practical and procedural skills, and then the underpinning knowledge, the scientific, biomedical sciences, as well as the social and behavioural sciences and health promotion. I would suggest, if you're thinking of applying for medicine, that you go on the GMC website. It's really useful. There's loads of information. There's loads of sort of ideas about ethical dilemmas, careers. The BMA website as well, the British Medical Association, is really helpful in looking for careers and looking what doctors do and just getting that extra sense of what they do. But this really gives an idea of all the things that will be in your curriculum. And talking of curricula, I will pass on to Lauren for ours.
Perfect, thank you, Judy. So it looks like a very complex which I think here, but what I want to do is just try and highlight the kind of the format and the structure of the program across the 4 years. So graduate entry medicine program is a 4-year program, as opposed to the undergraduate medicine program, which spans 5 years. And so what that means is it is a little bit more intensive, on the assumption that we have graduates who have the skills, more specifically than the knowledge to be able to work at this level. And so the first year of our program, I'm just going to move this down a little bit, you will see is a very university focused program. I don't like to use the terms preclinical and clinical, which is a kind of really old way of describing how these programs work, because actually you'll see, and I'll talk through year one a little bit more, we really do introduce patient contact and exposure into the clinical environment very early on in the program. But there is a heavier a focus on university delivery in year one compared to the other years. And the reason for this is to really give you that underpinning knowledge and understanding of medical education, of the basic clinical sciences, of the professionalism, values, the ethics, and all of those outcomes that Judy spoke about previously. And why that's really helpful is that you may or may not be aware that for this program, we will recruit and accept graduates from any background. So you don't need to have done a science-based undergraduate degree. And so we may have graduates coming from history or music or English degrees. And so this really intensive teaching delivery in year one ensures that all of our students are up to the relevant level in terms of their scientific knowledge and understanding to be able to go out onto those clinical placements and start to learn the clinical elements of the job and the actual day-to-day work as a doctor. So you'll see I've highlighted year one there. We separate these into blocks, but if you have a look closely, and perhaps might be better to do following our talk when you can slow it down and press pause, you'll see that there's a hospital week in there where we send students out into our hospital placement sites, and we also have GP and community placements dotted all the way along intermittently throughout year one, and we have the opportunity for interprofessional learning as well. And so the idea behind that is that you get a flavour for the way in which healthcare is delivered across various different sites. So primary care, secondary care, care in the community, which is really, really rapidly growing. And you also get that exposure, that contact with patients really, really early on. If you then look into your year two, you'll see a very kind of similar block type structure, but in this case, most of those blocks, our core clinical education blocks, are based out on clinical placement. So a huge majority of your year two will actually be spent out on clinical placement, either within the hospitals or at those GP practices and in some community care settings. What we do is we bring our students back for a number of weeks preceding each of those clinical blocks to really help prepare you to go out, to help deliver some additional teaching and support. And I think support's a really key element of our programme, actually, is to make sure that our students feel supported as they progress and develop and go into more specialist parts of the programme and more complex parts of the programme as well. If you look at years 3 and year 4, you will see that actually, it's essentially one year that runs from one end to the other. So actually, although we do have some breaks in there, and I must highlight, we are looking to see if we can deliver a couple more breaks in there for our students. At the moment, the way the Warwick curriculum runs, it's a very intensive 12 months, and we're hoping one of the things we can do in Chester is to try and break that up a little bit for the students. But if you look across years 3 and 4, the real focus then is on preparation for practice. So you'd go out onto what are known as specialist clinical placements right the way from year 3 all the way across into year 4. And those specialist clinical placements cover all of those specialty areas which Judy alluded to previously, and give you really broad exposure to all of the possibilities of specialties within the career of a doctor. And what's really interesting is because of the timing at which Chester have kind of come into this medical education, we're very nicely in time to then join what will already be a tried and tested assessment route, which is known as the MLA. So there will be a national assessment coming into force this year for any doctor graduating from a medical degree programme. And it means our students, by the time we get there, in year 4 in 2028, which will be our first cohort of students, that assessment will have been running for a few years, and we can really, really help to work and prepare our students for that national assessment right from day one. So I think it's a real advantage of starting at the time we're starting as well. So that's a very quick whistle-stop tour of your 4 years on the graduate entry programme. Very, very quickly, I'll just highlight the vertical themes of our curriculum that are going to run all the way through those 4 years. So I've listed them here over on the right-hand side of the screen, and you can see They include things like your personal and professional development. You've got your research and education and leadership, and then you've also got your basic sciences. So they cover all of those areas which Judy alluded to in those earlier slides, which help to illustrate really the breadth of the role and the opportunities for a career as a doctor. It's not just going into the hospitals and delivering the day-to-day care of patients, but actually you're involved in education, you're involved in research, you're involved in developing and trying to improve practice within the NHS. And we want to ensure that our curriculum helps to teach and prepare our students to become doctors who can contribute much more widely to some of those areas. So our curriculum is a spiral curriculum, probably relatively aware of that term. It's quite widely used across higher education, and it just means that we will begin in year one with the basic principles and the groundwork, and we will build as we progress through into years 2, 3, and 4 on all of those areas. And so our year one is really focused on the structure and functional, normal and abnormal structure and function. In year 2, we then really begin to bring in clinical application of that and experiences and exposure to the clinical environment. In our years 3 and 4, as I mentioned in the previous slide, we really bring that down to the specialty areas and specialty training. And then as we get towards the end of year 4, it's that preparation for practice. So it's the opportunity to go out there to shadow an FY1, so a foundation year doctor, and to really begin to integrate as part of the workforce even before you've graduated. And so you're really, really prepared to move into that role, into that first role of foundation training out in the trusts. So what we have done to try and bring this all together is we've grouped those themes into 2 different super themes. So we have a super theme which is known as the doctor. So that's bringing in, if you look at all of those themes, it's bringing in everything that we would consider that is outside of our scientific type themes. So we're looking at your professional development, we're looking at your understanding of community learning and community health, we're looking at ethics and values and law, and it's everything that helps to shape the doctor that you will become and the way in which you practice. And then we have the themes which fall within our super theme of science, so our anatomy and clinical imaging, the cell and tissue biomedicine, and your pharmacology and prescribing. And again, we will have additional support around our science super theme for those who don't have a scientific background to really help to make sure everybody gets up to that level that's required to be able to move into year 2, where you start applying all of that scientific knowledge into practice. So in terms of our teaching approaches, I'll whiz through very quickly. We have a number of different teaching approaches, but our focus is on case-based learning, or CBL. So our CBL approach uses simulated patient scenarios, so cases which will help you to understand some complex situations, and it will allow you to put everything you've learned across your basic clinical sciences and across all of the other themes that we've explored in the Doctor Super theme. You'll put those into application in this simulated scenario. So it's a really good approach in that it allows you to work in much smaller groups. So you can work really quite closely with a small group of peers and to really explore and analyze the case. And it really allows you, I think, essentially to apply all of that learning that we're going to be delivering across year 1. And it's, as I say, it really underpins the way in which we deliver across those blocks in year 1. There will be 1 case each week for most of the blocks. And so in total, there are 21 cases in year 1 which are linked to those blocks. And it allows you to explore a real breadth of different clinical cases. It allows you to look at the diversity of the population, and it allows you as well to really consider quite specifically as well the local community. So our focus at Chester, and one of the modifications we've made to the Warwick curriculum, is to really modify those cases to represent our local communities as well, and some of the challenges we face within the local community. And so it's something which you will find as you look through the curriculum, as I say, underpins all of the other teaching, which then links around to the case to make sure you've got everything you need to be able to explore those cases. Okay, can I pass over to you, Judy, for the
Yeah, sure.
simulation-based education? Thanks.
Yeah, so going hand in hand with the cases and to help prepare you for your placements, we have a real emphasis on simulation. So you'll have the physical simulated world, which is on your left of your screen with we've got multiple mannequins and high fidelity simulations, as well as low level clinical skills models so that you can learn procedures. You'll also learn in the real world, of course, with real patients. But what we're really having a focus on and developing this strength is our virtual world, which links the physical into the cases, and having our virtual citizens which will populate our virtual region, and they will help you learn. So the simulation is really important, I think, so that you're really, from a patient safety perspective, you're prepared to do anything on a simulation or a model or a mannequin before you actually do it on real patients. Wide range of provision already. Simulation is used widely across the health faculty. Here are some of our PAs using one of the mannequins. Here's our real life collapsed man on the floor. Apart from his eyebrows, he looks very, very real life. But you'll feel the skin texture and everything is very similar to real life, and it's even warm. And then obviously you work with real patients, but perhaps using what we call part task trainers so that you can learn procedures and communication skills. And this is just a couple of examples of our virtual and augmented reality. So Lauren and her anatomy team really do a lot of that 3D anatomy, the holographic. We've got an anatomage table, and we've got that linked to the simulation through touchscreen, so that you can see something anatomically through a specimen or a model. You can look at it in 3D, rotate it round, and then we can have a look at it in the simulation and really see then how that works with the real anatomy of a real person. So placements are vital to us, and we've got a number of partners across the patch. It's not an even shape, is our placement location, but we've tried to include them here. So we've included, you'll see, obviously we use our local hospital, the Countess of Chester, but we also go to Warrington and Halton Hospital. We use Robert Jones and Agnes Orthopaedic Hospital for rheumatology and orthopaedic, as well as some of the general medicine. And then we go over the border into Wales to Betsy Cadwallader University Health Board, and you'll work at Wrexham Myler. And you'll see through those hospitals that you'll learn across the range of patients and different conditions, so you will become really familiar with those. Our community work starts in very, very early in the first year, and we're using Cheshire Wirral Partnership for your first year community practice and for a lot of our psychiatry teaching, particularly the community. But you'll also work with a range of different community organisations, private, independent, voluntary organisations, so that you really learn about point of care work where people are in the community, which is actually where most healthcare is provided. And that includes primary care, and we've got a range of GP practices. For the first and second year, you'll stay more locally, and then as you move into your third and fourth year, you'll go for your longer blocks in primary care, a bit more across the region. So you'll see the different practices, and you'll learn about patients with their different demographics, because they do vary across the region. So as Lauren said, the placement learning builds up in a very gradual way. In year one, you have 5 community days, an interprofessional learning day and a primary care day. And then we have hospital week in March, where you actually go into hospital. So by the end of year one, you'll have got a really good feel about where care happens and who provides care. And that's where the interprofessional learning comes in. So you see a lot of care is not provided by doctors. In year 2, you move into 3 10-week blocks. One is in medicine, one is in surgery, and one is in other specialties. And interspersed with the hospital-based learning, you'll also go out into the community and primary care. So, for example, child health, a lot of it is out in the community. Mental health, a lot is out in the community. So you'll say inpatients and outpatients and patients in the community. In year 3 and 4, it gears up, and what we focus on then, you build on the foundations in year 2, and you go to specialist clinical placements, including primary care, but you'll go to obstetrics and gynecology, child health, psychiatry, the acute medical patients, musculoskeletal medicine. So you cover all what I would say the major specialties in medicine, not the subspecialties like cardiothoracic surgery, but you will go to the major specialists. And this helps you think about what you'd want to do for your career as well, but also you're getting all those working with different learning with different clinicians, so that you'll learn the different things and different patients. And then the last part of the year 4 is really getting you ready for your national assessment, the MLA, having an elective, which is the student choice block, so you can think about your career options and what you'd like to do, and then an 8-week assistantship where you work with foundation trainees ready to go into your foundation year. So a lot of support, programme lead, Lauren, year leads, but we've also got student support lead and senior tutors. All students have a personal academic tutor. And then when you're on clinical placements, we have a clinical subdean, a lead doctor and an education manager on each of the hospital sites. And then the lead GP on the GP sites provide that extra web of support for you. Our administrative support team is also really helpful, and we have a dedicated student engagement officer who will be often your first point of contact. And the university itself has a lot of support services ranging all the way from disability, occupational health, etc. So did you want to pick up the entry requirements,
Perfect, yeah.
Lauren?
So thanks everyone. I'll finish off. So we've got time for a couple of questions, but I guess this is probably what's really key at this point for those people who might be thinking about applying for graduate entry medicine. So our entry requirements are a 2-1 degree in any subject, as I mentioned previously. So this doesn't have to be a scientific focused undergraduate degree. Or if you do have a master's qualification, we would accept a 2-2 degree with that master's qualification. We do have a requirement for work experience. And I know it was mentioned at the beginning of this session that there'll be some guidance and maybe advice on how you might achieve some work experience, which would be relevant. So we have a 70 hours or 10 days of relevant work experience. I think the breadth really of what we'd accept for work experience is really there, because it's not just, you know, we're not going back to the days of you have to shadow a doctor, you have to shadow, you know, in a hospital or a GP, but it's anything that's health or care related that really gives you the opportunity to explore whether or not this is the right career path for you. We also have our entry tests. So I'll mention those on the last slide, which is the next one. So we have some threshold levels for our entry tests, but we do accept a broad range of entry tests compared to a lot of other medical programs. And obviously for our international students, we have an English language test requirement, an IELTS requirement as well. And then the final stage of our entry requirement process, as Judy alluded to previously, is the interview process. So we run MMIs or multiple mini interviews. It's just the format of the interview process is that we have station-based interviews where you move around 6 different stations, and we'll assess different elements of your character and your approach and your understanding of medicine and medical education, and all of those together will be considered in terms of whether or not we make offers to our applicants. So those entry tests I mentioned, the entry tests that we accept are the UCAT test, which is the most common entry test for UK-based applicants, but we also accept GAMSAT and MCAT, which are other entry tests which are generally used more in other countries, and that's really to make sure that we're open to accepting applicants from the international arena as well. But we do have some UK applicants who have taken the GAMSAT test, for example, because the timings of those tests do differ. So I would encourage you, if it is something that you're interested in, to have a look at the entry tests. So have a look at the UCAT and the GAMSAT sites, because the dates for those tests are already up there for 2025 entries. So our applicants will be looking to sit those entry tests in the summer, early summer of this year, because the application process for medicine is slightly earlier than for other programs. So we'll be looking at applications to be submitted and complete by October of this year. So I would urge you to have a look at that as soon as possible if it's something you're interested in. And this is just to give you an idea of what those thresholds would be for our entry tests. Now, you'll see I've put in bold that the test thresholds change each year. This is a normal process across all medical programs. What happens is those entry tests are all collated and gathered, and then the threshold level is determined based on the cohort for that particular year. But this gives you a really good feel for what those thresholds are likely to be. They don't vary a huge amount year on year. So for this year, you know, for UCAT, we have an overall threshold of 2540. For GAMSAT, an overall threshold of 60. So it just gives you an idea, a ballpark figure for what those thresholds are likely to be. But there's some really good, really clear information and guidance on the websites for those entry tests for medical students. So I would take a few moments to have a look at those. So that brings us to the end of our presentation. I know we've gone right up until the end.